This is a demonstration of the clinical quality measure application of the Zato Health Interoperability Platform. This demonstration was recorded running on an IBM Zato PowerLinux server using only de-identified data. Other applications of the Zato Health Interoperability Platform include the DRG dashboard application, the cross-clinical and genomic data application, the clinical documentation improvement application, and the newest demonstration which we're showing today is the clinical quality measure application. Another application under development is the behavioral health application, which will span clinical and behavioral health data. The design of the Zato Health Interoperability Platform enables a user to span multiple data silos of different healthcare applications simultaneously, including multiple EHR vendor repositories, which may be located in the same data center as a result of a merger, for example, or may be located in multiple data centers of multiple organizations, and can be accessed by the Zato Health Interoperability Platform over multiple networks concurrently. These networks can include local area networks, virtual private networks, and the internet. Zato Health has a statewide license agreement with the Medicaid program, which has expressed a number of needs, including those on the examples displayed for prediabetes screening, pediatric and adult diabetes and asthma, obesity, hypertension, smoking and smoking cessation, and so forth. Clinical quality measures have been around since 2007. PQRI was initially the standard. That has evolved to PQRS with over 200 different measures. And meaningful use reporting, which was started in 2011, was difficult to verify and so has been superseded. In 2019, CMS will begin the merit-based incentive payment system, otherwise known as MIPS. Within 2 years, it is expected that more than 80% of all healthcare funding will be based on quality measure performance. Here's an illustration of the MIPS program of CMS, which combines PQRS, the value-based payment system, and meaningful use program into a single merit-based incentive payment system, which, as you can see, provides rewards and penalties in this incentive-based program for how well a provider is improving quality measures and doing so verifiably. The Zato Health Clinical Quality Measure lead is Dr. Anita Kars, an MD who has significant experience in this area, having produced clinical quality measure reports for 100 providers, quality measure experience in a number of the quality measurements. Dr. Kars has managed and evaluated pilots and projects, worked with physician practice quality reporting, early diagnosis and clinical outcomes in sepsis, comparative effectiveness of therapies for breast cancer, and in an anticoagulation therapy for post-total joint replacement therapies. This demonstration will show an example CQM calculation leveraging source clinical documentation, and importantly show the verifiability of these clinical quality measures using the automatic hyperlinking to the clinical evidence Also, we'll show the ease of adjusting measure calculation with policy changes by payers, so that if CMS changes the clinical quality measure specifications for a particular measure, it's easy for the provider to alter that report.
The Zato Health CQM application includes a library of clinical quality measures from which a provider can choose a particular CQM or set of CQMs, and the application will compute the measures based on CMS eCQM specifications. The application also provides links, allowing the provider to verify the classification of each patient in each measure by viewing their records and see that they fit in the category where they have been placed. Let's look at one example of the clinical quality measure for diabetes uncontrolled hemoglobin A1C. Here is a diagram showing how this measure is computed. First, an initial population is selected that meets certain criteria. Patients between 18 and 75 years of age during the measurement period must have an active diagnosis of diabetes during this measurement period, and they must have had an outpatient encounter of one of several specified types. Zato Health queries its index of medical records and labs and gets a list of all the patients who meets these conditions. These patients are candidates to be in the initial population. For each patient, Zato Health tests any exclusions and exceptions to see whether that patient needs to be removed from the initial population. At the end of these steps, those that remain form the denominator. Then, for each patient in the denominator, the Zato Health CQM application examines whether they had a hemoglobin A1C test during the measurement period. If they did not have the test, or they had at least one test and the most recent result was greater than 9%, they are counted in the numerator as having uncontrolled hemoglobin A1C. Finally, the quotient is computed. Here's an example of a Zato clinical quality measures report showing the results of this analysis. Here is the denominator with the count of patients in the initial population. This CQM has no exclusions. Here's a count of the numerator, and here is the final clinical quality measure of 81.71%. The Zato Health CQM application also helps providers verify that patients were correctly classified. The user interface presents two lists of hyperlinks to the provider. One list showing patients in the denominator but not in the numerator, and one list showing patients in the denominator and also in the numerator. The provider can click on any patient to bring up the supporting documents that caused the patient to be counted in the classification they were put into. Here is an example. Here's a list of 2 patients that are in the numerator of the diabetes uncontrolled HbA1c query. We'll bring up this patient's most recent lab results, showing that this patient had at least one hemoglobin A1c test during the measurement period, with a value of 9.8%, putting the patient into the uncontrolled category and hence into the numerator.
This slide provides contact information for questions that you may have about this demonstration.